Hi everyone, my name is John Liu, and today I'll be presenting my and my partner's research in understanding and calculating COVID fatality rates through big data analysis. In this study, we investigate the fatality rate of COVID-19 in order to educate the public on the likelihood of someone that may contract disease and the probability that he or she could die or recover from the disease. And this is especially important to governments and businesses who want to know the best strategies to defend the public against this disease using containment, mitigation, delaying, quarantine, isolation, or other methods. And so here we have a model that is generally used and it's pulled from the World Health Organization and the CDC. And here we can see very perplexing and difficult lines that are hard to analyze the correlation between cases and fatality rates. And so in this research, we generate a better model of representing the pandemic and how it spreads to the public. So we first begin by generating a model of the disease dynamic. And so here we have a model where someone is first healthy, and then he or she is then infected, and then after testing it and confirming it, the person will either recover or die. And so the probability of moving from the one stage to the next is represented by the Greek letters here. And it can be seen that epsilon and delta should equal 1 because total recovered and dead should equal the number of people confirmed. And we also have to define a few terms. So the infection fatality rate is the total deaths divided by the total confirmed cases. The crude mortality rate is the total deaths divided by the total population. And the case fatality rate is the cumulative deaths and cumulative confirmed cases. And so as of now, it's actually hard to analyze the infection fatality rate and the crude mortality rate because we don't have data until the pandemic is over. So we have to rely on the case fatality rate for now. And so before we generate a model, we have to make some assumptions about research. And one main assumption is that there's a delay between when a person is first tested and when a person is either dies or is recovered. And so in this model, we can see the correlation of cases and deaths in the US, where there's a sharp increase of deaths that follows the increase in cases. And so in order to find the delay in cases and deaths, we can actually generate a Pearson correlation between the two functions. And here is our function where we find the maximum. And finding the max correlation, we'll find the max where the number of fatalities corresponds to the number of cases. And so here is a graph of that, where we have the delay on the x-axis and the correlation on the y-axis, where we found the optimal correlation between each country. And so here we can see that the US has a correlation at about 6 or 7 days, and then as for Italy, it's around 7 to 8 days. And so after studying the delay, we can actually generate a delayed case fatality ratio for each country. And this is given by the cumulative deaths and over the cumulative confirmed cases adjusted with the delay. And so graphing that out, we can see a much better model of the coronavirus and how it affects the different countries. And so we conclude that the case fatality rate in most COVID tracking websites actually varies significantly and fluctuates. And so a better model to model the coronavirus is through the delayed case fatality rate, which is calculated with the correlation delay. Thank you for your time, and we hope you enjoyed our research.